Thank you all for joining with us here today. We want to cover a lot of ground. First, I will start out with an update about the numbers as they have shown up today. As of today, the total number of Texans who have been tested is 427,210. The total number of people who've tested positive is 33,369. The number of active cases is 15,672. The hospitalizations confirmed are 1,888. The fatalities is 906. And the total number of people who have been tested positive for COVID-19 and who have recovered from that infectious disease is 16,791. So now for the fourth day in a row, we are increasing the number of people who have recovered from COVID-19 in relation to the number of people who still have active cases for COVID-19, now having more than 1,000 more people recovered than those who have tested positive. I also want to share with you the ongoing status that I have as of this morning with regard to availability of things like hospital beds. We show that there still remain more than 19,000 hospital beds available, more than 2,000 ICU beds that are available, and more than 6,600 ventilators that are available. Remember this, there was the requirement to set aside a certain percentage of hospital beds, of ICU units, of ventilators during the early stages of our response to COVID-19 to make sure that we would have those facilities available for anybody who tests positive for COVID-19. Remember also that pursuant to my most recent executive orders, we have allowed doctors and hospitals and other healthcare providers to begin to utilize those hospital facilities for the treatment of other types of patients unrelated to COVID-19. And as a result, what you should be seeing here in the coming days and coming weeks is a decrease in those number of hospital beds that are available, because those beds and those facilities should be going to patients with other types of diseases and healthcare challenges. Remember this, and this is so incredibly important. While we have been responding to every healthcare need of those who test positive for COVID-19, there have been some who may need to be diagnosed for cancer. They may have needed to be diagnosed for heart disease or some other type of physical ailment. It is so important that anybody with any type of healthcare ailment whatsoever, especially those ailments that could be life-challenging, that they have access to the doctors, the hospitals, and the health care they need. And that is why it is so important that this most recent executive order unleashes the doctors, the nurses, and the hospitals to be able to provide that type of health care that our fellow Texans need. And now they're going to have it. And we will continue to monitor these, as I will show you momentarily, why we are monitoring them so closely and why these numbers are important. One thing I want you to know is that as you can see from numbers, including the numbers from today, the amount of testing that takes place in the state of Texas continues to ramp up. We're not quite there yet. But the number of testing continues to ramp up. Today, the total number of Texans tested was 19,000. But get this, in the past 2 weeks alone, Texas has done more than half of the total testing that's been accomplished since this pandemic began in the state of Texas. So to put it this way, from March the 1st to April the 20th, there were 190,000 people who were tested for COVID-19. Since that time, there's been well over 220,000 tested. And as a result, that is demonstrative of the rate of increase that we have going forward. In addition to that, something that you will hear more about lately, and that is one of the many reasons why testing is going up is because the National Guard has been doing a fabulous job of crisscrossing the entire state of Texas to make sure that the more remote areas of Texas, as well as the urban areas of Texas, will be receiving testing. You're going to hear a lot of discussion today, later on, to provide you more detail about that, about the counties large and small across the entire state that have received testing recently. Yesterday, we had one of our twice-a-week phone calls with the vice presidents, as well as with Dr. Burks, as well as with Dr. Gerard. The reason why Dr. Gerard is important here is because Dr. Gerard is one of the people who is in charge of the testing operations taking place in the states. One of the main topics that was discussed yesterday in our phone conversation with the Vice President, with Dr. Gerard, with Dr. Burks, is what the federal government is doing, working with the states to increase the testing that is taking place. And here's what they said. They said that they are increasing both swabs as well as other testing supplies across the country. Their goal is to test 2% of the population of each state every month. That would be approximately 600,000 Texans per month, just pursuant to this one testing regimen that is provided by the federal government. And then today, the CDC said that it will send 750,000 collection swabs to Texas between now and June the 1st. Now we can go to that data. So there's certain data that I use that I wanted to share with you so you can understand exactly what it is that I'm tracking to see how Texas is progressing. I'm showing you this data that is hinged to the date that I made the announcement to begin to open up business in Texas. So one of these lines, the middle line, is for that date. The top line is 1 week before that. The bottom line is 1 week after that. Obviously, it doesn't have today's number in there, but I wanted to show you basically what we see, not just day to day, but also what I look at week to week to see how Texas is doing. So looking at column number 1, you see vertically the column of the people who are who are being tested. And you can see right there between April the 20th to May the 4th in that 2-week time span, we more than doubled the number of people who are being tested. So that is a good thing, but it's so critically important that people understand that just the number of tests in and of themselves is not all that meaningful of information. And I'll explain more why. The next column says new tested. Those are the number of people who were tested that day. So on April the 20th, there were 7,684 tested. As of the day I made the announcement to open up business in Texas, there were about 14,496 tested, and then as of yesterday, more than 16,000, almost 17,000 people tested. Again, good progression, always an increase in those tested. Again, the number tested is important, but as a number standing alone, that number is meaningless. That number is relative only to context. And the same is true with the next number I will give you. You'll see going back to April the 20th, there were 553 who tested positive. You'll see when I issued my executive order last week, it was 666. And then today, as of yesterday, 784 who tested positive. That brings us to the next column, which is one of the most important data points that we look at. And that is the percentage of the people who were tested who test positive for COVID-19. As you can see back on April the 20th, the percentage of the people who tested positive was 7.2%. Then that number went down to 4.6% on the day that we made the announcement, and 4.65% as of yesterday. Anything below 7.2% is going to be a good number. Remembering this, and that is if you were to go back earlier in the April timeframe, you would have seen that the positivity test rate was closer to 10%. In fact, sometimes over 10%. If the positivity test rate is more than 10%, that's one of those red flags that we begin to look at. Not if it's just a one-off day of testing more than 10% positive, but if there are multiple days and a trend line begins getting us back up to a 10% positive ratio of those being tested and those being tested positive, that is a warning flag for us to keep track of. So one thing that I look at every single day is what is the percentage rate of those who are tested, who test positive. And so here's what this means when it says 4.65. What that means is that more than 93%, actually more than 95%, more than 95% of the people who are tested test negative. Know this, as you're going to hear later, we've been spending a lot of time in areas where there is a high positivity rate. It could be at meat packing plants, it could be at jails, it could be at senior centers, where we're going in to try to identify everybody in those settings who may have tested positive. And despite concentrating on areas where we think there may be a high level, a number of people who could test positive, the fact remains that more than 95% of the people who are tested test negative. And so we have a lot of people in this state saying, well, we need to test far more people. The fact of the matter is there's people who are in Texas who have no symptoms whatsoever, have no need to go up to a testing site to be able to be tested. And as a result, those who are testing positive remains low. Another number that's very important in our analysis of how well the state is responding to this challenge is hospitalization rate. And you get that rate by going through these numbers. So look at hospitalizations per day. Go back to April the 20th, obviously it was 1,411. On the day that I made the executive order opening up Texas for business, it was 1,563. As of yesterday, it was 1,533. The fact is that if you were to go back and look at these numbers over about a month time span, you will see that those numbers on average are fairly the same. There will be some days when it'll be 100 or 200 more, some days where it could be 100 less. But it's been on the positive or negative side around the mid 1,500 level the whole time. However, understand this important fact, and that is over that same period of time, when the number of hospitalizations have remained on average roughly the same, the total active cases have increased. So go back to April the 20th and you see the total number of active cases at 13,257. Then look at when I made my executive order last week, it was just a little bit more, 13,464. Then look at yesterday when it was 15,358. So if you were to look at the total number of new positive tests going back to the third column, you would see, well, that's an all-time high of 784. You would see that the total number of people tested was an all-time high, but yet you'll see that the total number of active cases was at an all-time high there. But during those highs, you actually see the hospitalization rate decline from 10.6, went back up to 11.6, now down to 10%. Actually, it was 0.998%. And so my point is this: even though we're testing more people, even though more people are testing positive, even though hospitalization rates, hospitalization numbers fluctuate, the hospitalization rate has remained steady or steadily declining. What that tells us is that Texas is fully capable of being able to manage the health care needs of everybody who contracts COVID-19. There has never been any evidence whatsoever that Texas either has or will be facing the types of challenges that we've seen in places like New York, New Jersey, New Orleans, or so many of these other places where they were scrambling to amass the resources that were needed to respond to COVID-19. My point is simply this: Texans as a people, Texas healthcare providers as a group, have done a remarkably effective job of responding to COVID-19 to ensure that we minimize the impact in our state and minimize the necessity to tap into our hospitalization rates. Another thing very important, when we go to this next slide, and that is the positive test rate is also declining. So we are testing more people, as I pointed out. So as a result, the number of people who test positive is going up. But importantly, the positive test rate is going down. As you can see on that slide, since April the 15th, we cut the positive test rate in half, from 15.52% to 5.76%. And that's all for that slide. As I mentioned also, the total number of recoveries has improved daily and has now surpassed the number of active COVID cases for the past 4 days. Now more than 1,000 more people have recovered from COVID, more than the number of people who have active COVID cases. Texas ranks third in the United States in the most recoveries from COVID-19. Now, it must be emphasized, the positive results that we are seeing are the result of one thing, and that is that Texans have been following guidelines about safe practices to reduce the spread of COVID-19. They've been following distancing practices. They've been wearing masks. They have been avoiding crowds, and they've been sanitizing their hands, all of the right strategies. Every single Texan has the full capability themselves to make sure they do not contract COVID-19 by practicing these very simple strategies. And it's important. It's important for this reason. Even though we have slowed the spread in the state of Texas, even though our numbers with regard to hospitalizations and those testing positive, they all look good, the fact remains this. As it stands today, there still is no cure for COVID-19. There will be cures and immunizations and medicines that can be taken for COVID-19 in the future. But between this point and the point in time when those cures and medical treatments will be available, we must find a way to bridge that divide. So we've done it by the fact that we have shown that essential businesses can operate while slowing the spread. Remember this important fact, and that is before my executive order on April the 27th to open up businesses to begin to increase economic activity in the state of Texas, long before that, going back to the time of my essential services order, there were many essential services operating in the state of Texas, whether they be grocery stores, restaurants for carry-out purposes, hardware stores, industrial manufacturing facilities, construction, all different types of activities like that. Those businesses were operational at a time while COVID-19 spread was being reduced. So we can open up business if we follow those same very strategies those businesses were using, and that's exactly what we need to do. By following those same safe strategies, we can also show that we now can have non-essential businesses operate while still containing the spread of COVID-19. Our ability to show that we can coexist with COVID-19 depends on ongoing efforts at good hygiene to continue to slow the spread. So it's up to Texans whether or not we remain open and in fact open up even more, or alternatively, if actions have to be taken that would lead to greater containment in certain areas. If Texans stop using the distancing strategies that they have been utilizing over the past month, they will cause an increase in COVID transmission. If that happens, it could lead to some counties having to impose stricter standards. Well, one thing I want to do today is to make some clarifications and modifications to the executive order that I issued last week. So there was one thing contained in our executive order last week that there was some uncertainty about, but it was still contained in the executive order. And it involves funerals, memorials, and burials. And then I'm going to add to it something that was not in that executive order, and that is weddings. So for funerals, memorials, burials, and weddings, they are all treated the same as church services that have limited seating arrangements. And you'll need to go back into the guide that I issued at the time to see what those seating arrangements are for church-type gatherings. Understand this, and that is, whether it be for attending church or attending a funeral, memorial, burial, or a wedding, we strongly encourage at-risk populations to try to watch or participate remotely, remembering this very important point, and that is almost 75% of the deaths from COVID-19 in the state of Texas are a result of people contracting COVID-19 who are age 65 and older. We can go so far to reduce deaths in Texas if we do even more to protect the most vulnerable 65-year-old and older population from being exposed to COVID-19, and that requires in part that people in that age cohort try to remain at home if at all possible. So in addition to that, for funerals, memorials, burials, and weddings, we for the vulnerable population, we would also recommend the provider of those services to consider designating an area for the at-risk population. Additionally, the standards that are applied to churches that apply to these types of settings, they include alternating rows, meaning skipping a row, and trying to have an area of 6 feet spacing between parties. One individual from a household may sit with another individual from a household, or I'm sorry, from another household. Otherwise, limit seating to household gatherings alone. Now, for weddings, we want to make sure that at wedding receptions, the same type of practices are used at wedding receptions as are currently used with regard to restaurants that are open. That would mean generally 25% of listed occupancy, no tables more than 6, keeping seat space at least 6 feet from other tables, and maintain 6 feet separation between parties. Bottom line is, for wedding receptions, go look at what the standards are for restaurants and comply with those standards. Another clarification that I want to provide based upon the executive order that I issued last week. If you recall, there had been an executive order about being able to walk around in parks. And in that executive order, one thing that we removed from the previous order was the need to wear a mask when you're in a park. We said we highly recommend that people wear a mask, but there would be no mandate or penalty or anything like that if you failed to do so. Remembering the fundamental premise, and that is, if you wear a mask, you are ipso facto decreasing the possibility that you will be contracting COVID. That said, we want to make sure we clarify what the standard is for park-like settings. That includes the beaches, lakes, and rivers, including river rafting. All of those categories, the categories of beaches, lakes, rivers, including river rafting, are to be treated with the very same standard as parks are to be treated. So maintain at least 6 feet separation from others where possible, who are not within the same group. Groups at beaches, parks, lakes, and rivers may not exceed the greater of the number of members from a household, or up to 5 individuals who travel together. Also, I want to provide further clarification on restaurants. So for restaurants, there was and is a seating capacity limitation of 25% that applies to indoor seating. It does not, however, apply to outdoor seating. If seating is outdoors, however, the same distancing standards are required as are imposed for indoor seating. Now, in my remarks last week, I said this. I said that we want to see certain operations open up as soon as possible, including barbershops, hair salons, bars, and gyms. And I said at that time that we were working with our medical team and the industry to open these as soon as possible. Well, beginning that day after I issued that executive order, we went to work that day and every day since then, working with local businesses and industry leaders in these businesses. And we are grateful that so many small business owners for what they did in working with us to try to hammer out some strategies that met with the approval of our medical team. With that in mind, effective May the 8th, this Friday, cosmetology salons, barbershops, hair salons, nail salons, and tanning salons are able to open. There are rules in the best policies manual that we have provided that all of these should consult. Here's a summary of some of them. One customer per stylist, unless the individual is waiting for service. You can only wait inside if they maintain social distancing of at least 6 feet from others. We recommend using an appointment system only. If allowing walk-ins, only wait inside if they can maintain a distance of 6 feet from one another. Otherwise, waiting should occur outside or in a person's vehicle. Operating stations should be limited based upon the ability to maintain 6 feet separation between the stations. And we strongly recommend for both customers and for stylists that they wear face masks. Listen, one of the apprehensions and concerns about opening up barbershops and hair salons and similar types of businesses was the fact that the people operating the business as well as the customer, they're very close to each other as that service is provided. The only safe way that you can go about providing this service while ensuring that we're doing everything possible to prevent the transmission of COVID-19 would be for both the person providing the service and the customer wearing face masks. So once again, detailed operation instructions are provided both online and in the handbook that these operations should consult before opening up their facility. And let me go back and make this point clear. Just like I said last week when issuing the executive order opening up business, this allows these types of businesses to open up. It doesn't require them to do so. So I mentioned May the 8th, this Friday, as a time when they can open up. And I understand that some maybe think, well, there's no way I can be opened up by then. There's too much I have to do. And that's completely understandable. Or they may think, well, I'm afraid about my health being exposed and hence I don't want to open up. That's fine. No one is being required to open up. Every owner of every salon should use their own best judgment about when is it going to be best for them to safely open, whether it's May 8th or sometime after May the 8th, making sure they will be able to maintain the quality standards that are expected of them so that they are effective at preventing the spread of COVID-19. Now, we've also had the ability to work pretty much on a daily basis in talking to owners and operators of gyms and exercise facilities, finding out what strategies work, finding out the types of sanitation activities they do have and where sometimes they don't have adequate sanitation practices. And we know that these proprietors of these operations, they have a need for the income, but also they have the ability to provide their service in a way that will not cause someone to contract COVID-19. As a result, we are going to allow gyms and exercise facilities to open up beginning May the 18th based upon these guidelines. Initially, they can open up to 25% capacity for the gym component. What I mean by that is that there are some type of gym and exercise business operations where they don't do so within a gym. They may do so outside. And obviously, if you're outside, you can't have a 25% capacity because who knows exactly what that means. What you have to do is you have to maintain safe distancing practices if you're outside, making sure people are not close enough where they can transmit COVID from one person to another. As it concerns gyms, for the initial time period, until we're able to both get better strategies and get better control of COVID-19, showers and locker rooms must remain closed during this first phase. Again, detailed standards will be provided. Here are a few. All equipment must be disinfected after each use. Customers should wear gloves that cover the whole hand and fingers. So why this? Obviously, one of the reasons is when people touch their hands on a piece of equipment and then they touch their face, they could transmit the COVID-19 germ and hence contract COVID-19. Customers should wear gloves that cover the whole hands and fingers, as I mentioned. They must maintain 6 feet social distancing inside a gym.